Hi, I'm Dr. Susan Tan from Park City Medical Center. I'm a consultant child and adolescent psychiatrist, and I look after children from the age they can learn to walk and talk all the way up to 18, and I even follow them up when they want to stay with me. ADHD is a condition that is common. It affects 4 to 12% of children all around the world, and the letters ADHD stand for Attention Deficit Hyperactivity Disorder. So ADHD is a condition that is common, but sadly it is not recognized in children, and a lot of them suffer complications because of untreated ADHD. There are many causes of ADHD. Some of them are preventable, some of them are not. There is a genetic component. Children who have ADHD, their parents are 2 to 8 times more likely to have ADHD themselves. So therefore you see the genetic component is very strong. And even babies who are born, who are twins, identical twins, have a much higher chance of ADHD than children who are born non-identical twins, that means dizygotic twins. But these are not preventable. Males are also 3 times more likely to have ADHD than females. But let's focus on the preventable factors, because research has shown that pregnant mothers who are having hypertension, who are having diabetes, who are having psychosocial stress, who smoke, who drink, and who use drugs have a high risk of giving birth to children with ADHD. So these are real factors that any parent who wants a child with a happy life will want to prevent this condition by taking such precautions. Plan your pregnancy, get antenatal care early, make sure that all these complications don't affect you, and therefore you don't have also the other added risk factors, which is a preterm baby, low birth weight baby, which is also affected with ADHD. And one of the factors that many of us must be very wary about is screen time, because of the fact that research has also shown more than 2 hours of screen time in a child less than 7 years old is associated with ADHD. And sadly, many mothers are using handphones as babysitting devices. So you do not know that you are actually predisposing your child to ADHD. So this is something we really can do about. Well, as we had discussed earlier, a child with ADHD means he cannot sit still in school. He's squirming around, he's not focusing, he's distracted by other children, by the car that passes by. Obviously, he'll get into trouble with his teacher, he won't finish his homework, he won't do well in his exams, and therefore that would lead to disciplinary problems in school, behavioral problems. He gets into fight with other people because of his impulsivity, and he doesn't think before he acts, so he gets into problems with the school authorities, and they label him as a naughty boy, a difficult child, and in the end he will become anxious because he doesn't know how to study for exams. He might even get depressed because he feels that he's a failure. He also may end up saying that no point studying, I might as well go and do something I'm good at, like pickpockets, and then he might turn into crime. And might go into other things like abuse substances like cigarettes, cannabis, drugs, alcohol, and this leads to also even more problems because he might end up as a dropout, and being a high school failure or a college failure means he has no employment opportunities, and this means that he's going to snowball into a life of complications which are all preventable if only he was treated early. Well, the most important thing is that parents must look out for these symptoms. If you have a child with symptoms of inattention, as discussed earlier, impulsivity, and this is something that goes on and on for at least 6 months, around the age of 5 or beyond, watch out that he may already have symptoms significant of ADHD. If teachers say that your child is not happy, he's not turning up his work, he's not handing up his assignments, and he seems to be struggling with focusing, help him get assessed early. Pick up ADHD early and give your child a chance to be able to get over this hurdle in his life, so that he can at least have a chance to study well and be able to perform well and be happy and have a happy childhood in school. So parents can also look out for things the child is good at, not just compare him with his peers or his siblings. If he's not very good at studies, look out for his other talents, maybe in music, maybe in art. These are the things that you want to promote so that the child has a sense of being happy with himself and being proud of his abilities, and maybe that could be his career pathway. So what you want to do is to help the child appreciate his potential, appreciate the fact that he has strengths and weaknesses, so overcome the weaknesses with you and him working together as a team. And then later on, when the diagnosis is made and the intervention is started with the teachers as well as with the academic authorities like the education system. Treatment is not just about diagnosis. The treatment is also in a comprehensive way. It's what we call biopsychosocial spiritual. So the biological aspects of treatment are medication. There are medications available all over the world which are also available in Malaysia. The other part of biological management is not just medication alone, but also basic things like sleep, diet, exercise. For children with ADHD, it's very, very important for them to have a chance to exercise every day, because exercise itself helps to increase the endorphins, the feel-good hormones, and reduces stress in the child and the parent who goes with the child. So exercise is important. Sleep is very, very important for children with ADHD. More than 8 hours is a general rule. Of course, when you sleep, you refresh your brain, and therefore your brain can work better and function better and is less irritable and less lethargic. The next thing is also diet. Diet which is healthy, with balanced diet, high in fiber, fruits, and unprocessed carbohydrates like rice and things like which are not highly processed like pastries and cakes, which would actually help children to have a good balanced diet and good nutrition to grow as well as to be able to function in school and home and everywhere. So besides biological management, there's also psychological management and social management, which means that behavior interventions are important. Very young children are usually started on what we call occupational therapy. They go to an occupational therapist who teaches them attention training, who teaches them how to organize themselves, who teaches them social skills, how to manage with anger, how to be able to communicate, social skills, and this helps them in life. Later on, they may even need to see a counselor if they have symptoms like anxiety and depression, and even a therapist, which actually helps. The child doesn't feel that he's the odd one out, or he's a difficult child, or he's a naughty child, but the child feels he has a problem, but his parents love him, the teachers care for him, and the therapists are there for him, and everybody works as a team to help him overcome those problems. So therefore, you see a child with the best chance in life to overcome all the hurdles and succeed in life in whatever his potential is. If the child now becoming a teenager, becoming a young adult realizes that, okay, I have to focus because I have this lecture in university. If I want to do well, I need to focus. He will therefore prepare himself for that. He will make sure he will sleep early. He will make sure that he is ready for the lecture. He would read before he comes, and therefore he can manage his symptoms. If such a person, as he grows up into a teenager or a young adult, is able to manage those symptoms that have been in the way of his learning in his childhood for at least 6 months, then perhaps it's time for him to consider stopping the medication. This is something very important, and this is recommended by the clinical practice guidelines by our Malaysian Ministry of Health, as well as by experts all over the world. Nobody wants to be on medication forever. But a very important thing to remember is do not stop medication before major challenges like major exams, SPM or IGCSEs, because obviously you want to sail through the exams smoothly and then slowly consider tailing off the medication. But please consider doing this with your doctor who is looking after you, whether it's a child psychiatrist or a developmental pediatrician, because they want the best for your child and they will want to make sure that it's smooth and it doesn't get in the way of his life, and he still carries on enjoying his life. So these are some of the references that you can look up, because parents who love their children will definitely want to find out more. The internet is here, Google is at your fingertips, so please look up these references and see for yourself. This is information that is shared with parents and educators all over the world, from the American Academy of Child and Adolescent Psychiatry. There's a website, American Academy of Pediatrics. We also have the Malaysian Ministry of Health and Clinical Practice Guidelines. And we also have the Australian website Beyond Blue, which supports parents and children with ADHD. If you see your child struggling in school or having problems concentrating, do not hesitate to look up all these symptoms and look for your nearest healthcare provider so that you can confirm if your child has ADHD and see what other problems there could be. We also want to make sure that the child has the best opportunities in life to develop his full potential and is not always struggling, so that his childhood is something that he looks back on with joy and with happiness, and he remembers his good times with you as parents, and he enjoys his childhood. Even though the COVID is around, children can still enjoy their childhood. Parents can still take action and make a big difference in this child's life.